challenges. What were they thinking? Will this bill improve Medicaid? Nope. Will the bill increase the number of Americans with health coverage? Nope. Will it lower costs on the exchanges? Nope. Will this bill bolster employer coverage? No. Will coverage now provide more access to care, a promised time and time again by Mr. Trump himself? No.
But, sir, is the major decrease in the number of people, according to the CBO, who will have health insurance, is it freedom, or is it that some people will no longer be able to afford health insurance under your plan?
Obamacare. No shortage of drama among Republicans themselves over this bill, with members of the administration out today trying to tamp down GOP opposition.
Hi, I'm Dr. Forsythe. Boy, there is a lot of concern now about health care and what we're going to do about health care insurance for everybody here in the United States.
Insurance under your plan. I want to show a specific case that the CBO put up. Look at these numbers. In 10 years, the CBO said, a 64-year-old with an income of $26,500 will pay $1,700 out of pocket under Obamacare for health insurance. Under your plan, the CBO says, that same person will have to pay $14,600 because insurance companies can charge more, and the tax credit that you're going to offer is smaller than the subsidy that Obamacare will offer. So what they're saying is this isn't freedom. This isn't people voluntarily deciding not to have health insurance. It's that your plan makes it unaffordable for people.
One of the things I think is useful is let's back up and ask, what is health care for? Well, certainly you can think about circumstances where we get into accidents, we fall off of ladders or trees, cardiovascular abnormalities that just are so overwhelming that no individual can take care of that. So we can think of these catastrophic situations where people need insurance. And then you come to the more everyday sorts of things having to do with colds and flus and stomach upsets and so forth. And that's where traditionally we thought about the family doctor and seeing the family doctor to get a sense of comfort about what's going on. So undoubtedly there's going to have to be some healthcare changes. Now, I was born in Canada, I was trained in the United States, and fortunately did a fellowship in Sweden. So I've had a chance to see a lot of different systems in operation.
Around and telling us how terrible healthcare is all over the world, all these terrible waiting lines. And yet when they do international studies and they ask people how they think and how they feel about the healthcare system, you know what? The United States is often down below many of these countries on much higher levels.
And the system in Sweden, for instance, started out to be a universal healthcare system where all the taxes went into paying for universal healthcare. What happened in the late 80s was that companies were losing their employees to things like back illness, or they lose their workers for up to a year and a half, during which time the government had to pay for their salaries. So there was an experiment that was done, and Saab Scania and Volvo were the two big beginners of this. They developed their own in-house healthcare systems. And it turned out that that was so successful that by the early 90s, the Swedish legislature allowed private practice medicine to exist. Now, they were still paying taxes to the universal healthcare system, and that would allow you to go and see a doctor for all kinds of different things. But it also allowed the existence of private hospitals and private clinics, and that dual system worked out very well. Now, interestingly, there's lots of other examples of how that's taken place in Switzerland, in Japan, and even the National Health Service in Great Britain. So today in healthcare, we've got a system now where we've had tremendous advances in surgeries and tremendous advances in medicine, but still we don't have enough dollars to take care of the chronic disease burden of obesity and diabetes and hypertension, osteoarthritis, mood disorders. And we're just being overwhelmed in primary care by needs in these areas. So we can simplify our healthcare system and make access available, but now there's going to have to be a real impetus on how we can help give lifestyle management to our patients. because that's the place where we can have by far the biggest impact in reducing overall healthcare costs. How can I be healthier? How can I feel better about myself? And how can I do things more functionally for me and for my family? Now, I've been working in this area for the last 25 years, and it's absolutely remarkable what can be done if people are really hungry for information from their doctors. Obamacare, of course, started with the impetus of let's give everybody health care. And then the question was, okay, well, how are we going to do that? What happened was there was going to be a mandate that everybody had to buy insurance. And when people went to buy insurance, first of all, there weren't enough people that did it. And then the people that did do it found out that the cost of that was so much more than the health care that they might have had from their companies or would have been available had they simply gone to a Medicaid clinic or other places. And where they ended up going was they ended up inundating emergency rooms because, well, I can't afford health care. Emergency rooms are not the place for most things that happen in medicine. Emergency rooms are for people that have been in accidents and horrible things have happened to them, you know, heart attacks and that sort of thing. But it's not the place for primary care medicine. Unfortunately, all that's done is increase the overall cost of medicine. I think it's very easy to understand why universal health care is such a compelling notion. I mean, everybody would love to be able to ring up their doctor or ring up their clinic and have sort of instant access to health care. And one of the things that we've noticed in primary care over the last decades is there's more and more a sense of not only just the great need, but also the sense of entitlement. And actually, I think we have to get back to a system where there's much more of a partnership between our healthcare providers and the patients that we're serving. Patients have to start taking control of their healthcare. There are actually simple ways to do that, and I think with good thinking and utilizing benchmarks of other countries that have had to deal with these problems, the Switzerlands, the Swedens, the English system, and the Japanese system, just to name 4, are good ways to start studying how to make this system better. I happen to know some chief executives of healthcare companies, large healthcare insurers, and so I hear from that side about what's going on in the delivery of healthcare insurance. And for most of the post-war era after Eisenhower, we've relied for our healthcare through employee healthcare systems. And unfortunately, the cost of that increased over time. And now with companies trying very, very hard to reduce their healthcare costs, obviously the cost of insurance is a big part of it. So probably the biggest thing that can happen to increase competition would be to get rid of the artificial borders to selling insurance. Right now, insurance for healthcare can't be sold across state lines, which seems silly because obviously you can buy just about everything across state lines, and nothing could be more important to people than healthcare, that's for sure. I think when people think about what would be the ideal situation in healthcare, something like a return to the ability to have a doctor, a family doctor that you know and that you've been with for perhaps many, many years, maybe even make house calls. That's certainly possible, but it's not going to be possible within a government-run universal healthcare system. That's going to be a special service, just like other special services that we have in our lives. And if you would like to be able to pay for that, you can pay for that. And that could probably be bundled into certain insurance programs. For sure, a return to the old-fashioned way in which there was a real partnership between your doctor and your healthcare would be a huge step forward. Well, one of the questions that comes up often is, what about the Canadian healthcare system? And I personally, and with my family, have lived with the Canadian healthcare system and what's going on there for a very long time. My father was about the age of 80, very healthy, always active, and ended up with some pain in his chest, which is angina related to his heart. And I remember having a conversation with his family doctor. You know, what are the next steps now that Dad has this going on? You know, what are you going to do? And the first statement that I got from this colleague doctor in Canada was, you know, Ken, your dad has lived a really long life. You know, I'm not sure that we can do anything extra for him right now. And that was, of course, shocking to me. I've heard this story repeated over and over. So, unfortunately, I had to bring my dad down to the United States to have a procedure done, putting in stents, that helped him tremendously. So I think the Canadian healthcare system before the Canada Healthcare Act actually was a two-tier system. There was a basic fee that was paid by the government for a whole variety of healthcare services. Everything from going to your doctor for a cold to perhaps having to have your appendix out or something like that. And there were clinics that would, because of the way they were set up, they would take whatever the government payment was for that particular service, and that was payment in full. In other areas of the country, there were private clinics that were set up, and if you wanted to go to that private clinic, the private clinic could take the government fee, but they could also charge whatever they thought was the fair price for that service that they were performing. And so we had a two-tier system. There were true market forces involved, and it seemed to be a very good system. Unfortunately, that was lost, and I think that's one of the reasons why so many Canadians, doctors as well as patients, come to the United States or even go elsewhere to get services that they can't get in Canada. The question comes up right now is, what do? We live in this system right now that's called Obamacare, and actually it's part of a whole hodgepodge, including Medicare and Medicaid and Obamacare. So as government and politicians wrestle with this, it is an enormously complex problem. And undoubtedly, we need to think, I think, about really basic needs in medicine. So with respect to the question, you know, is politics really not helping us get to the answer? I suppose the obvious answer is yes, but I don't think there's any way around that. This is going to be a very difficult set of political discussions to have, but probably now's the best time to have it because the situation is only going to get worse and worse. If we do nothing, the system will get worse and worse. For example, Medicare and Medicaid cannot keep growing the way they're growing and continue to survive. There just simply will not be enough money to do that. But there's a lot of waste in medicine. There's much more efficiencies that we in medicine can do to make our healthcare delivery system better. But we need to get rid of artificial barriers to competition. Competition is one of the things for insurers and for doctors and for clinics that would help tremendously.
Obamacare is not going to last. There's no way Obamacare could stick another 2 or 3 years, let alone 10 years. And so they're comparing an Obamacare plan that's mythical, that won't exist in 10 years. Then they're saying, well, if people are going to buy what Obamacare is going to make them buy, then they won't be able to afford it. Here's the point. We believe that we do need to add some additional assistance to people in those older cohorts. But the apples to oranges comparison that's happening here is we're not going to make people buy something that's so expensive that they can't afford, that the market's not going to offer. And so where I dispute that comparison is it suggests that we're going to have the same kinds of plans being offered in 10 years that Obamacare would otherwise offer.
But, sir, I mean,